Welcome, everyone, to Williams on Workplace Justice. I'm very excited for my guest today, Dr. Flores, who is joining us from UChicago Medicine AdventHealth. He is the Director of People, Culture, and Strategy, and he is here to talk to us about psychological safety in the hospital setting. So, welcome, Dr. Flores. I'm so glad to have you here today.
Thank you for having me, Kim.
So we met last year, and one of the things that really struck me about our conversation and the good work that you're doing at Advent Hospital is this very kind of direct framework around dignity and the use of that word so explicitly. Tell us more about that and how you and your role kind of help shape this framework.
Thank you, Kim. For us, dignity really is the foundation of everything we do because in healthcare, we have noticed that ultimately healthcare is a delivery process about vulnerability on both sides of the patient care. For us, dignity is a very intentional process in moments of stress, burnout, a hierarchy, complexity. Dignity can be the first thing that is lost. So that's why for us, it matters for us to ensure a culture of dignity for patients, for caregivers alike.
Oh, that's brilliant. Also, to kind of support this, introduce these service standards, which really just blew me away because these include phrases like love me, which I love that, keep me safe, make it easy, and own it. So, how do these service standards show up for the doctors and nurses and people who work at the hospital?
Absolutely. The service standards are the foundations of how we deliver and how we practice and live out our mission. Our mission, we have a faith-based mission of extending the healing ministry of Christ. So when we talk about extending the healing ministry of Christ, what we talk about is compassion. But the service standards are the way in which we shape our culture. For us, keep me safe has to do with how we keep our environments safe, how we provide safety for our patients, for all of our consumers, including our team members, how we ensure their personal safety is our highest priority. And you call out specifically love me. I remember when we met you, that really resonated with you. When we say love me, what we mean is how we extend uncommon compassion in the clinical setting and also in non-clinical settings. Uncommon compassion really is empathy in action. Is not an aspiration, it's a practice to extend that type of healing to every person every time as we serve with genuine love, human love. And then we talk about make it easy, and basically that's our vision to remove bottlenecks and remove the complexity out of healthcare in a way that we make it easy for our patients to feel safe, to feel love, and to heal the whole person, not only their physical ailment. And then we also talk about own it, and that has to do with how our team members, our leaders, how we promote a culture of responsibility for the person and the situation right in front of us.
Amazing. That's amazing. And so, it kind of leads to like the broader concept of psychological safety, because
Mhm.
for a lot of folks that means different things. But like if you had to define it specifically for Advent Health, how would you articulate that? What would that definition look like for you?
You know, I will define psychological safety because from the foundation that every person's voice matters, that within the team, within the clinical and non-clinical teams that we lead within our organization, every person is invited to speak up. That's why we say, keep me safe. You are welcome to, and not only welcome, you're encouraged to use your voice, to speak up, to ask questions, to admit mistakes. We have a framework, a very, very beautiful framework to encourage people to do service recovery. That means if there is a mistake that takes place in the clinical setting, we provide the psychological safety to treat the person who made a mistake, even with dignity and respect, especially when they are not in the room. We provide the psychological safety and the safety to express concerns, to offer new ideas, to bring solutions to the processes without fear or embarrassment or retaliation or even punishment.
That is so beautiful. Like if I got into an accident in Washington, D.C., I would actually want to drive to Chicago to get care with you. That's really amazing because we don't always see that in a lot of places. And, and to be fair to folks, I know, our healthcare workers are, have done some heroic work over the past couple of years. And I'm sure this is an extremely trying period for them still. And so this is really, really incredible what you're doing. And so when we talk about this idea of keep me safe, like how does that imply, how does that work in the employee context? Like, you just kind of shared about like how we may be doing that for the patient, but what about for the employee?
Mm. For the employee is the promise. We have something we call the team member promise. And the team member promise implies that every employee needs to feel like family from day one. That means that on day one, they need to know that they belong. And that means valuing their perspectives, valuing their voices, their previous experiences, valuing who they are and everything that they bring to our organization. So keep me safe for us means that you are free to use your voice, you are free to use your perspective, even to challenge what you observe in order to improve our processes and our culture. And we strive to be that culture, and we're practicing that from day one when we receive team members in our new hire orientation. As a matter of fact, we have a 4-hour session in which we show them, we call it the whole care experience, and we show them what it means to feel safe, what it means to use your voice, what it means to collaborate with other clinicians and with other non-clinical team members to care for themselves and to care for the patients that we serve.
I normally don't do this, but I think for your YouTube, I normally include like information on how folks can reach you, information about the hospital. But I have a feeling for folks watching this right now, they're going to want to know if you're hiring and they're going to come want to come work for you. So I'll be sure to include a link there. That's really
And we are.
beautiful. Okay. Yeah, all my years in HR, I've never heard of anything this awesome. So thank you for your work there. That's really great. And so, after they go through that training, I hope that that's really hitting that message home and people are taking that to heart. So are there any examples that come to mind where people are really, leaning into this idea that they feel safe enough to compromise with others, work with others, be vulnerable, reach out to others? Any examples come to mind?
Yes, absolutely. So, well, let's recognize that healthcare is a very complex environment. There are hierarchies in healthcare that sometimes make safety, psychological safety harder, but even the most essential. And we recognize that silence is risk, that psychological safety saves lives. So one of the most beautiful examples that I have seen is when we have observed clinicians coming together to troubleshoot for problems within the clinical setting. And often within those meetings, we can see physicians coming together along nurses, coming along together HR professionals to think about process improvement, removing bottlenecks, improving communication. But often that doesn't really take place. That type of collaboration that doesn't really take place, except when we are very intentional to bring everyone to the table, equalize everyone's voice, and give everyone an opportunity. And I have seen several times over the last 3 years and a half being here in UChicago Medicine AdventHealth when clinicians, physicians, nurses, administrators come to the table. And when you see a nurse speaking up, using her voice. Maybe she's a nurse with 2 or 3 years of experience, but she's granted the psychological safety and the social safety to use her voice and provide her subject matter expertise. And then sometimes that perspective could be challenged, and then they could challenge each other, but by challenging each other, they find a solution. And then they own the solution in the clinical setting. Patient experience improves, your retention improves as a result of that. It's a beautiful thing to witness.
Like it, that sounds really amazing. I mean, definitely sounds like an organization that you want to work with and want to work for. So really well done. So often we kind of talk about these emotional benefits. And like you just gave a beautiful example of how, someone feeling safe enough to speak out could be a matter of life or death and in the line of work that you do. But do you ever also look at the bottom line? Like, is there a cost benefit to some of this stuff? Any examples that you can think of there?
Absolutely. Okay, so I think that well-being often is seen as a program, often as a program under total rewards, which is great. And we offer many different offerings and benefits to our team members. However, what we have noticed is that also well-being is not only a program, is not only an offering, is not only a benefit, but also is a competitive strategic advantage. So I have seen benefits from reduced turnover, increased retention, fewer agency or costs associated with agency nursing or other medical professionals, better employee satisfaction scores, improved patient experience scores. When caregivers stay and thrive, systems become more stable. You retain institutional knowledge, clinical knowledge, well-being supports sustainability clinically and financially. And of course, we know that there is a connection between well-being and psychological safety. So we definitely have seen the results. We have measured the results also where well-being and psychological safety interventions have taken place. We have been able to measure the results financially on the cost-saving effects of such interventions.
That is amazing. Now, patients, like, how do you think in particular that they benefit from this? I mean, you kind of have already given two kind of examples, like the nurse that feels safe to speak up, how they're communicating about a patient who maybe made a mistake or, is vulnerable, not just because they're ill, but maybe something that they've done. Are there any other examples of like how this can be especially beneficial for patients who show up in hospital settings?
Oh, absolutely. I mean, when caregivers, when clinicians, nurses, and physicians feel respected and they feel safe and supported, teamwork improves, collaboration improves. And a key dimension of an effective and efficient and safe organization is collaboration between those team members, between or amongst clinical team members and also non-clinical team members. Communication improves. Adverse events are prevented. Quality and safety and reliability improves. The team maximizes their strengths, and healthcare feels calmer, more coordinated, and less rushed. And patients feel that they feel a non-anxious environment. When they feel a non-anxious environment, this experience transfers directly to how they feel safe in that environment. And therefore, not only patient experience scores, of course, we want patient experience scores to improve, but what matters is that we have made a difference in the life of that particular person through consistent care. Their needs were taken care of, but also their physical and emotional and even spiritual needs were nourished.
That is so beautiful. Again, you make me want to move to Chicago, even in winter. So that's
Please
really,
come to Chicago. Today we are at -10.
oh my
It
God.
feels
Okay,
almost
you had
20,
me till
but
then. Still sounds nice.
yes.
But- okay, so last question. I'm hoping that someone is here working in a hospital setting. If somebody wants to replicate the good work that you've done, what's the first step that they could take?
I would recommend start by listening. Listening is deeply associated with psychological safety. But then after listening, take note of that voice that is being heard. The number one factor that I have noticed that discourages people is when they don't believe that action is going to be taken once they use their voice, that change is not going to occur. So listen and then model the change you want to see in your hospitals, in your organizations. Model psychological safety, use the data from listening, create interventions, make sure that the people that you serve, the communities that you serve, make sure that they know, communicate how their voice is being operationalized into organizational change. Psychological safety is not a program, it's a practice. And we as leaders, we need to go first. We cannot ask people to speak up if we're not willing to change what they are suggesting that we should change. And again, leaders needs to go first.
Such beautiful, beautiful words, and at a time where I think we really need that. So, so grateful for your time today. I'll be posting below on all the ways folks can get a hold of you if they want to learn more about all the magical things that you have done. I'm so grateful to have you out in the world. Thank you for your time today.
It has been my pleasure, Kim. Thank you for having me.